It's my pleasure to introduce Dr. Lauren Ng Tucker, a neurointensivist here at Mayo Clinic in Florida. And she's going to be talking to you about TakoTsubo cardiomyopathy. Please welcome Lauren.
All right. So first off, TakoTsubo is kind of a misnomer because I guess true TakoTsubo cardiomyopathy in the proposed Mayo Clinic criteria actually excludes brain injury and brain hemorrhage. So a more appropriate title that I'm going to refer to it is neurogenic stent myocardium. And some people think even neurogenic stress myocardium is a better nomenclature for it. But just moving on, I have no disclosures. And pretty quick objectives. We're just going to go over neurogenic stent myocardium and then also review the role of focus in the ICU or focused cardiac ultrasound. So first, we're going to start off with a case presentation. This is a patient who was in the ICU within the last 4 months. She's a 36-year-old woman. She presented with altered mental status. She was reportedly acting strange for about 4 hours at home. She was taking care of some young children. It wasn't until an adult arrived and noticed behavior and called EMS that she was taken to the ER for evaluation. She had a medical history of sickle cell anemia, anxiety, depression, and headaches. Her initial triage vitals had a heart rate of 99, blood pressure 111/88, respiratory rate 28, SATs are 100% on room air. Her GCS was 7, E1, B2, M4. She was reportedly agitated, not responding to questions, moving all extremities. She had a right gaze deviation. Her pupils were minimally reactive, and she had some anisochromia with the right greater than the left. So this is her imaging. She has a subarachnoid hemorrhage, and you can see something right over here, which on conventional angiogram, you can see that there's a basilar tip aneurysm. So some of her initial laboratory data, some of the labs that were drawn on admission, she had an elevated troponin of 138, which on the second one was down to 94, and then this was her admission EKG. So you can see that there's some T-wave inversions. She has some ST segment changes, and she also has a prolonged QT. So as a result of the elevated troponin